So my name's Simon Kitchen. I'm the president, the world's very first Rotary eClub, and it's open to everyone across the world. Obviously, we speak English, but so much of the world speaks English as well. So it's really amazing to get people like Vijay here to be able to share some wider kind of global insights. And then we've got Steve, who's our secretariat. Hi, Steve. Just want to wave your hand. He sends emails out to everyone and did all the agenda. And then we've got Ivan as well, who's our treasurer, so he looks after all the money. So if you're a member of the club, you will have paid the money to Ivan and so forth. And we've also got Peter, who's joined us, who's from Bipolar UK, so he helps do all the admin of it. And then the rest of us, there's a few. So we've got Paul Allen. Do you want to just say hi? One of our eClub members. And Peter Thomas as well, one of our regular members. And
sorry, another Peter, yeah.
Another Peter.
Paul,
so
you're on mute, by the way, sorry.
Cool. So a very warm welcome to all the members. And if we'll go through, we'll do 15 minutes, Vijay, of you talking, and then we'll do a bit of Q&A. So Vijay, I can't remember how we got to know each other, but Vijay runs Bipolar India. So I'm also the chief executive of Bipolar UK. So he's the chief executive of a sister charity, and I had the most amazing conversations with him about the experience of bipolar in India. And there's some really interesting contrasts and also some similarities as well, because India is obviously a massive country, and in some respects, the healthcare in India is actually a lot better in the UK. There's some aspects of where there's kind of rural communities where people are perhaps living a bit better with bipolar, but have absolutely no support at all. And then there's kind of an intermediate part of India where people are kind of experiencing the stresses of modern life, but don't have any healthcare, where they're really struggling with bipolar. So I think there's loads of really good learning from India that we can take for the UK, but also there's things that we can help do in the UK that might act as an inspiration for India as well. So Vijay, I'll hand over to your good self now. If I pin you, and then you can do. There we go, spotlight for everyone.
Are we waiting for more guests to join in, Simon?
What's that, sorry?
Are we waiting for more guests to join in?
I would start, because we're recording it, and then what we'll do is we'll send it out to those who can't come along. So I would just start, Vijay. So I'll do your presentation, and then we can take some Q&As.
Yeah, please let me know when to begin then.
Please start now.
Yeah, all right. Yeah.
In which part of India are you dialing in from, Vijay?
Yeah, okay. All right. So good afternoon to everybody, and thank you, Simon and Rotary UK, especially the eClub, which is a partnership with Bipolar UK, for this great opportunity for us to share the journey of Bipolar India with you. So, what was the origin of the organization? Where did the idea arise from? So it begins with my personal story. My onset of symptoms happened at the age of 14, and diagnosis happened at the age of only 40 years, a full 26 years later, when it was a full-blown manic episode with psychosis that led to me being admitted to hospital, and then subsequently the diagnosis happened at that time. So there was a full complete gap of 26 years where I wasn't even treated for depression or any other disorder, or even under any support of therapy during that entire span of time. So this gives you the context of what awareness was like in the late 70s, early 80s in India, and even in the subsequent decades. All right. So we started Bipolar India initially as a website to disseminate information, create awareness, and of course raise conversations around it. All right. And when we talk about it in 2013, social media had not really caught on in India, because now we know social media is such a powerful medium to spread the message. So in that context, it was very necessary, I felt, to sort of create a platform for this cause. There was intense stigma around the disorder, which is there till this date. But now we have more lived experience, stories being shared, and that sort of helps sort of soften the blow to a certain extent. What I personally experienced at that time was an overwhelming sense of isolation, of the sense that I was one of the only persons living with this unique condition. This is a very rare condition, and in complete of ignorance of the enormity of this problem, how many other people also live with this condition. Yeah. So, and of course, we all know what delay in diagnosis and bringing in treatment and interventions at an early stage, how they affect outcomes later on in life. So all these factors combined were the sort of motivation to create a platform for it, to address it. What is our model sort of, I mean, what is it sort of based around, the advocacy model? So the thrust of the model, firstly, to bring in that context, unlike the UK, we don't have a robust public health model which is accessible to the entire population. In fact, a negligible portion of the population has access to public health institutions where they can avail services either free of charge or at very low costs. So the majority are left to fend for themselves. Yeah, and there are stats. The National Mental Health Survey 2016, 17 talks about a care gap of between 80 to 85% who are under no treatment at all for severe mental health conditions. That is the extent of the gap. So our thrust is on providing affordable and accessible services, mental health care services, which are consistent in quality, of course. That is also important. And of course, there is a huge chasm between urban India and rural India, and rural India faces these problems at a more magnified level, one could say. Our thrust has always been putting the users at the center of policy design and implementation, and we make concerted efforts in those directions. And again, in the Indian context, families are an integral part of the support ecosystem, which we cannot ignore. Yeah. So they are also very much an active part of our community. So part of the advocacy workshops, advocacy work that we do, this is a sort of demonstration of that. We conducted a workshop way back in 2009 after the introduction of the Radical Mental Health Care Act 2017. So we firstly ourselves need to educate ourselves with the rights that derived under these powerful acts so that we can pursue them better. What is Bipolar India's model? I mean, what does it look like, essentially? So we conduct regular peer support meets, which are hybrid in nature. So although our base is in Mumbai, we are headquartered in Mumbai. So the most of the offline meets currently happen in Mumbai. But our community being based all over India, we touch base with them through online meets on on a regular basis, and we do conduct thematic workshops as well. Yeah. To support our peer-led work, we have a panel of experts from the mental health domain, such as psychiatrists and therapists, and also from the holistic health domain, such as yoga trainers, noted yoga trainer, and a nutritionist on board as well. And their interaction with the community is an ongoing basis that happens. Yeah. We firmly believe that just looking at symptomatic relief from the disorder does not really solve problems. The illness needs to be looked at the overall, the 360-degree perspective of what it does to a person, to the family, and the repercussions of it. And so how can we support the person in the rehabilitation journey? Here also the context is very relevant because India really doesn't have a robust social support model from the government for persons with disability. So a person who is out of job, who doesn't have any means to sustaining himself or herself. That is also something that is essential to be noted here. Yeah. Now, psychosocial support to our community members is a key to what we actually do. And then most of it is delivered by our own peer mentors. And it is very heartening to see over a period of time how organically the next rung of leadership has been developed. Even youngsters, people with a lot of seniority, it's a combination mix of people providing their own suggestion, all based on lived experience. So I think one could surmise it as the complete model is designed with the insights that are drawn from lived experience. We very strongly believe in a holistic health approach to recovery that includes components such as exercise, yoga, nutrition, so on and so forth, which are all of course evidence based. We cannot ignore those aspects, can we? And of course, that is to support the mainstream treatment coming in from psychiatry and therapy, of course, not to sideline the utility or the need for formal care. And these are the studies which back the kind of approach that we are. Pathare S, Kalaji, and Krishnamurthy, their article on peer support for mental illness in India, an underutilized resource. In fact, they run one of India's largest peer support, and community-led initiatives, which touches the lives of thousands and thousands of people, especially in rural India, which is the unrepresented area. And there is a research done by NIMHANS India on PubMed, which talks about the value of yoga in psychiatric practice. About our advocacy at the macro level, we have been at the forefront for ensuring that health insurance covers mental illness. So even this might be shocking to the listeners in the UK and elsewhere who have joined in globally, that hitherto mental illness was not covered in insurance policies. And although with the advent of the Mental Health Care Act and subsequent guidelines from the governing insurance body, on paper, it was mandated that all policies bring in parity between physical and mental health, but that was not happening. So we have been even supporting petitions in the Supreme Court to bring about changes in this regard. We are also actively into implementation of the Mental Health Care Act and the Rights of Persons with Disability Act in partnership with other advocacy firms such as Face Me India and other organizations who we have synergy with. And a very important vertical of ours is diversity and inclusion. So as I said, since we don't have social support for persons with disabilities of a desirable level in India, it is so important for people with mental health conditions to get some sort of a livelihood support, either in the form of jobs or consulting opportunities or even entrepreneurship. What do we do for creating more awareness around mental health? So we have been conducting the World Bipolar Day national conferences since the first such conference that we conducted in 2016. All these are held in Mumbai, and we have delegates coming from pan-India, from the farthest corners of India. The last edition of the conference saw 150 people attending it in person. media coverage. In fact, I would like to share this, that just today, one of the articles about the work that Bipolar India does for, and the community-based model that it that is at the core of it, won an important award in journalism, awarded by a fellow NGO in India, SCARF, which is Schizophrenia Research Foundation, based in Chennai, India. So that was an article which was published on the BBC platform. All right. Very recently, Bipolar India has joined hands with other organizations, including researchers from NIMHANS, Bangalore, and it is an outreach grant project focused on mental health that will be creating events, hosting events, and creating awareness in multiple cities across India. So it is known as the India Bioscience Grant Project. And Bipolar India is a proud partner of this. We have plans to create awareness and sensitization programs at a workplace. I think that is a glaring need, because workplaces are themselves hotbeds of stressors for persons living with mental illness, and it is high time that when we talk about the inclusion agenda, we also talk about how people can sustain themselves at such jobs. This is a glimpse of our the last edition of our World Bipolar Day event, which happened as recently as 2nd of April 2023. What does our organizational structure look like? So at the apex of it is our registered non-profit, which is Mental Health Support Foundation, and a little bit of this also, because although our flagship initiative happens to be Bipolar India, we have now branched out into supporting people living with other disorders. So I could say it would be fair to share here that of the mix of the community that we support, say 80 to 90% would be people living with bipolar disorder, and we do have a 10% kind of a representation of people living with schizophrenia, OCD, depression, and so on and so forth. So we want to broad base ourselves. So the Bipolar India would be a key initiative, but we would also want to support people living with other disorders. And Let's Walk Together is the initiative that I would like to talk about a bit, because that's also very much in focus for us especially in the coming year. It would be we'll be making active efforts to place our community members and even people who apply from outside our community for jobs. And there is something of pride to share here. We already have some 60 CVs on board here. Now it is about looking for partner organizations in the form of corporate entities, startups, even individual firms who would be able to hire these people after their disclosure of mental illness. And for this initiative, we have stalwarts as our partners and supporters in the form of mentors, such as Center for Mental Health Law and Policy, Mariwala Health Initiative, and Manorati. Also, I would like to share that we have recently received a funding from Mariwala Health Initiative. That is our first grant that we have received. And with joy, I would like to share, right now I'm sitting in a premises that we have very recently acquired, in fact, just a week ago. And this would be a center which would be working as our back-end admin office, as well will facilitate our meets and other engagements that we do for the community. What could, the Rotary Club, if we envisage it at a global level, as a coalition of bipolar support organizations, what could that sort of bring to the table? Let's look at that. So of course, I believe the biggest advantage is taking awareness beyond the people who are living with the condition to people who have no idea about what bipolar disorder or any other mental health condition looks like, and how could that be supported by them to mitigate stigma around it. I think that would be a core aspect of it. Sensitization is important. When we talk about stigma, does it just stop at the stigma? We need to sensitize people, how to be empathetic, use of appropriate language in our communication, these kind of aspects around it. We could attract allies for advocacy, policy change, and of course implementation of these policies then. I think that's also very important, because sometimes we chart a lonely path without support from governments, from the corporate entities and the social sectors. So when all of these come together, I think Rotary could be the sort of a glue to bring them together for further impact. And of course, this is also something that all of us look forward to, is support for the non-profit organizations which are already doing work in this domain. And that could be in the form of financial support, in the form of grants, or of course, any other synergy that comes in. And I think I'll wind up my presentation now, and we'll open up the, open it up for interaction, but would like to just end it up with this thought of mine, which is central to every bit of work that we do. I firmly believe, and that is also the credo of the organization, that recovery is incomplete without rehabilitation and assimilation in society. Thank you very much.
Vijay, thank you so much for sharing that. And there's so many parallels, which is amazing, really. I mean, it just shows the kind of commonality of bipolar across continents, doesn't it? And all of your work that you're doing, especially, we haven't done it. We did try doing a yoga class once at Bipolar UK, and it didn't really stick. But all that holistic approach in the community and the rehabilitation is all fantastic. I mean, that totally aligns with what Bipolar UK are doing. Just going to open it up now if there's any questions from the group.
Simon, just before the questions, I think we're going to stop recording just in case there's anything sensitive.
Okay, there's any private, so I'll stop the recording. So just to formally thank you, Vijay, we'll take the recording up and then we'll do some questions.